Good afternoon and welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School, Washington University in St. Louis. Happy to have you with us today as part of today's program. Happy St. Patrick's Day, as that may apply in our audience. For folks on Zoom, you are muted through this program. We can neither see nor hear you. We also can't call on raised hands, but the chat feature is enabled, and we definitely want the audience to be a part of this conversation, sharing thoughts, questions, and comments. For folks joining us on YouTube, we're really glad to have you with us, and we don't have a direct way to bring you into the conversation this time. So register next time, and we'll be happy to have you in the Zoom with us. Before we get started about today's program, I just want to let you know a few things that are coming up. Continues to be a really busy time for our Open Classroom program. On Thursday, so that's tomorrow, Drs. Gerard Hollins and Andrew Thiesing are presenting on public administration, finance, and government budgeting. Then next week on Tuesday, that's the 23rd, Dr. Elvin Gang is presenting on adaptive strategies for retention in HIV care in Africa. That's a program offered in partnership with our friends at the International Center for Child Health and Development. And then on Wednesday, March 24th, we're actually capping off the series that this program is a part of related to COVID vaccine. Dr. David Curiel is going to be with us to talk about the science behind the vaccine development and really get deep into questions people may have about temperatures and supply chain and how did this happen. So we're looking forward to that. Today's program, though, we have three leaders who've been deeply concerned with bringing equity to COVID distribution in our region. My co-host, Cynthia Williams, is going to be moderating, and I'm going to be in the chat. We're joining the conversation, though, in perhaps about the last 15 minutes. So for the audience on Zoom, what I want to ask you to do is please do feel free as we go. Put your comments, put your questions in. I'm going to be taking notes. And then towards the end of the program, I'm going to pop back up on the video and hopefully do justice to being your voice. But now I want to introduce my friend and co-host, Cynthia Williams. She's the Assistant Dean for Community Partnerships at the Brown School. That means she's the lead contact person for many of the key projects our school has within the St. Louis community. She's an alum of the Brown School, a licensed clinical social worker, deeply involved in much of what we've been doing literally for decades. Please welcome my friend, Cynthia.
Thank you, Janet, and welcome to our panelists this afternoon. It's so good to see each of you. I have a special fondness for each one of you in memory, so thank you today for joining us. Of course, it's already been said, this is the second of a series of three talking about the COVID vaccine. This was an entitled Race, Risk Factors, and Equity in Vaccine Distributions. So before we get very far into our conversation, of course, I'm going to ask each one of you, according to your position on my screen, to give an introduction and tell us how the vaccination, COVID-19 vaccination, has impacted you in your work. Elizabeth, you're to my left on my screen, so would you start off, and then we'll go to Angela and Miranda.
Well, thank you so much, Cynthia and Janet, and to all of you who are out there in Zoom land. Before I can talk about the St. Louis Community Foundation and our role with vaccine distribution, I want to roll back a tiny bit and talk a little bit about our role with COVID response, because that sets the stage for what we're doing. And I should introduce myself. I'm Elizabeth George. I'm the Director of Community Investment at the St. Louis Community Foundation. And on March 11th, 2020, we launched our COVID-19 Regional Response Fund, and we seeded this fund with funds from the St. Louis Community Foundation and a handful of our foundation partners here in the St. Louis area. And over the course of this past year, we've raised over $6.5 million, which we've used to support nonprofit efforts to address the impacts of the pandemic. So we have been in the middle trying to figure out how we can support the nonprofits that are supporting the communities that are most impacted. We also pulled together an advisory council that's comprised of representatives from public health, from philanthropy, from the community, from corporate. It's a really fabulous group of about 13 or 14 people that have been meeting for now over a year, to help us think through the use of these funds that we've raised. And we've kept equity as a core principle, and we've kept our focus on disproportionately impacted communities. But at the behest of the advisory council, we also said we're holding back some funds because we know we're in this for the long haul, and that COVID's not going to go away quickly, and there are going to be needs after the immediate crisis of March, April, May sort of ended, and we moved into the this long haul that we've been through over the past year. So as we have thought about where we are and what we are doing with the remaining funds, we've been looking at what's happening with COVID today. So we've provided some funding for Prepare STL and the regional response team to do the education around the vaccine and helping people to make informed choices as to why they would want to, or perhaps why they may not want to have the distribution or have the vaccine. We've also looked at eviction prevention. We've looked at the digital divide and how the digital divide is impacting people's ability to access healthcare in general, education, workforce development. And now we're really seeing how the digital divide is impacting people's ability to access the vaccine. And most recently, for the last few weeks, we've been really drilling down on where we can use our remaining funds to help support equitable distribution of the vaccine, and what the right places, what the right triggers are for us to provide support for our nonprofit organization. So that's sort of what we've been up to and why I'm here today.
Good afternoon, everyone. I am Angela Fleming Brown, the CEO of the St. Louis Regional Health Commission. We are a nonprofit organization in St. Louis that works to ensure those who are uninsured and underinsured have access to health care. And one of the main programs we do that through is a program called Gateway to Better Health. That is a coverage program for those who are uninsured in our region. And so we kind of got into the space of COVID-19 and really ensuring that those communities who are under-resourced and uninsured have access to testing. And so that's kind of how we started in the space. And then after thinking about testing, we wanted to make sure that many of our Black and Brown communities that are usually mostly impacted by disease and chronic disease that were high risk factors for the COVID-19 disease had the information needed to really be prepared to protect themselves through this pandemic. And so we're part of the collaborative initiative, communication initiative called Prepare STL that my fellow panelist Elizabeth just mentioned. So I'm very thankful for that partnership in the region. And so from that work, we have continued to remain engaged in the COVID-19 pandemic throughout the last year. I'm also a member of the St. Louis Regional Pandemic Task Force. So as our efforts have now moved from testing to vaccine distribution, we have definitely been centering a lot of these conversations, really working, as Elizabeth mentioned, to make sure that we have adjusted our communication strategy to provide our communities with information about the vaccinations, a part of conversations about distribution in our region, working with many of our community health centers through a partner organization called the Integrated Health Network to ensure they had supply and the resources needed to meet some of the demand that they're seeing in many of the communities that they serve. And so that has been our space in this. We are now focused in also on the equitable distribution because we realize that many places, and it's actually through a report that the state released, that there are still vaccine deserts in many of our regions in St. Louis, and we want to make sure that those individuals have access to vaccines and do our part to make sure that we are partnering as a region to get those resources there. Thank you.
Okay.
I am Miranda Jones. I'm the district director for Congresswoman Cori, who represents Missouri's 1st District, which is all of St. Louis City and a big portion of St. Louis County. And so our role in this, there's been several different roles. One, as a congressional office, we field calls from constituents every day. And so we hear from constituents about the lack of finding the vaccine, the lack of resources, and our frontline community engagement specialists are often equipped with lots of resources. So all of the things that you've been talking about, Angela, all the resources you're talking about, Elizabeth, we try to connect with those resources so that we can make sure that our constituents know how to get on to the websites, where to go to try to get that help. One of the things that we are finding, and we know that, we've heard things about there's not enough vaccine at one point. Now, things have changed within the last week. Things have changed from at the time that this probably was scheduled to now. It's been a lot of movement, but the first issue was getting the vaccine where it needed to go. Then we find a digital divide. So it's not only that we know that there's vaccine hesitancy in our community with good reason. Historically, we understand that there's some hesitancy, and there is a mistrust, and there's some trust that needs to be built between the medical community and the communities that we serve. And so, we've been, having those conversations, those tough conversations with lots of different groups and lots of different constituents, and really talking through that hesitancy and outweighing the benefits versus those things that historically have plagued our community. Also, transportation is an issue. We know that transportation has been an issue. And then kind of going back to the digital divide, we're finding that a lot of our residents, with that first tier that opened up, which was senior citizens, for them to actually go on to a website and be able to, do the things that they needed to do was really difficult. So they were calling and finding a lot of busy signals. So we started actually helping them to physically register, helping them to get online. So from the constituent side, we pride ourselves as an office of really working directly with our constituents. So that's one. The other thing, obviously, one of the big things is helping to pass the American Recovery Plan and the American Rescue Plan. I'm sorry. And the American Rescue Plan was our community is going to benefit greatly from the plan that was passed. We are going to get approximately $700 million in our area. About 500 million is going to St. Louis City, and about 200 million, it's a little less, it's about 190 is going to St. Louis County. And there's a lot of different ways that money is going to be used, from helping with vaccine distribution, going to educational institutions. There's just a lot of different layers, housing and different things in that particular rescue plan that we are very proud. The Congresswoman fought really hard to make sure that our area got what it needed to be able to help us to get back on the road to recovery. So we are really excited about that. And then last but not least is being able to be a liaison to Biden's administration. And as we know, Biden's administration released on March 11th his plan for where we're going to go in terms of our recovery. One of which is making sure that all Americans have the opportunity, or that American adults, that by May 1st, that all the tiers will be open. And so everybody will be eligible for vaccines. And so, being able to have all those details and go through that Biden plan, we have all those details, and we'll be able to share throughout the course of this call today. But, Congresswoman Cori Bush, being a nurse, being a person, who has experienced COVID, earlier in the year, those are last year, actually 2020, right? Because we're in 2021, it's still going. She's just really concerned and really has her eye on where we are with this pandemic and where we're going, and what we need to do to try to help in our region to help get us on the road to recovery.
Thank you all so much for your very comprehensive explanation about how the COVID-19 distribution and the vaccine has impacted you. I'm going to go back to you, Angela, for a moment. You mentioned the vaccine desert. And I'd like for you to elevate, what is a vaccine desert? What has contributed to the vaccine desert? Would you address that for us?
And so when we say vaccine desert, it's almost like food deserts. I'm sure people resonates with that term, but just places in our region where there are not locations that are actively distributing vaccinations in the community. And so, you know, I can talk a lot about what contributes to that, but also maybe a few years ago, we did a study that looked at zip code data of kind of where access was for our region. And we do have just zip codes in North County, really out in North County, where there are just health deserts. So there's not a health center, a hospital, or a provider there that is providing like basic primary care services for individuals to do. So they have to drive in. A lot of our places are located in the city, so they either drive into the city, or the few health centers are located out in North County. And so that is basically kind of how we were seeing the vaccine set up. When we first started, many of the hospitals were the first receivers of the vaccination in our region. And for North County, the closest hospital out there is Christian Hospital, that I'm sure many people are familiar with. And then you kind of come in closer into the city to go in for many others. And so just because of the limitation of the providers that are out there, the access to vaccinations has been far and wide and missing largely from that community. And so when you have issues like transportation, people don't have the ability to drive. It's really hard for them to get access to the vaccine, and when they made the choice to get it. And, you know, we've talked a lot about some of the distrust in our community, but we are finding that people do want it. And it's just been trying to find it has been much of the issue. And so really one of the things that we've been talking about is how do we begin to partner with community organizations that are located there, and having our providers do those partnerships so that people who are trusted in the community can really do the outreach and really get people engaged. And as long as we provide the supply, that they have the access in order to get those vaccines out in those communities. And so definitely that helps with a lot of the issue with the transportation barrier that we're seeing. You know, we had testing, there were many mobile options. And so some of the deserts that we saw there, where you don't have access to a provider, people were driving out. So many of our providers had mobile options to testing. So they would go up and drive their van into many of these communities where we haven't seen those particular resources being implemented in this vaccine distribution. I think some are on the way, but that definitely has been a slow process as we've moved into thinking about distribution. And so just thinking more about how we do different community partnerships to really bring providers to the communities instead of have patients travel in.
Thank you. Would anyone else like to respond to that?
I know originally, in terms of the private pharmacies, Walmart was one of those providers that originally was planned to get the vaccine, and there's no Walmart in the city of St. Louis.
Right.
And so addressing those things and having, having it, there's a lot more Walgreens and CVS's and things that are, integrated throughout the community. I know that was an issue and really contributed in those early days to the desert situation.
I think along with the desert is who, once vaccines are available, who's accessing those. And we've talked a little bit about that already, but Angela mentioned Christian Hospital. And I think it's important to think about how Christian Hospital has acted and reacted. So, they are there up in North County. They had vaccine available. They put out, or BJC put out that vaccine was available. And when Christian Hospital started to look at the data of who was coming to the hospital to receive vaccines, what they saw was it was people from West County, it was people from South County, it was people from, not the people in the area in which they are. So even within these vaccine deserts where there is support, where there are vaccines, people weren't, the immediate neighbors weren't accessing. So then Christian Hospital said, well, why is that? And this gets back to some of those systemic issues that we've touched on. Yeah. And some of it is might be resistance to the vaccine, but as we've already heard, as Angela said, there's less of that than I think was anticipated back in November, December, January, or at least that's what's being reported. But more importantly, it was people not knowing that the vaccine was available and or people not knowing how to access. And, for the longest time, we have this strange system, you've got to register and people are registering on 7 or 8 different registration systems, one for each of the hospitals, one for the state, one for the county, one for the city, and then you have to be able to check and recheck and recheck and recheck. Hospital disaggregated the data and said, we have to do more to reach out to our neighbors. And they have, and they've instituted, efforts to hold in-person registry or in-person, not even just registration, but getting your appointments, scheduling appointments at churches, at Christian Hospital on Sunday afternoons. They're talking about it in places like the St. Louis American. They're doing things to let people know that the vaccine is available there and helping people to get to that, to get that appointment. That doesn't necessarily assist with the transportation issues, and there are other efforts that are taking place to try to get transportation addressed. But that's one way that I think some of the vaccinators are trying to really look at how to make sure that we're reaching down into community and getting to those people who most need it. So I really think hats off to Christian Hospital for that.
Yeah. And can I add the digital divide? Again, those are the first tier that was open, 75 and above, my mom, I'm not going to tell her age, Mom. I'm not going to tell your age, but she will call. That's her. She's going to call, but she's not going to go on her like to register at a hospital online. A lot of people are using the what do you call, like Slew Care. They'll have, their portal, and, BJC has their portal. She's not using My Chart. And a lot of people that got in were already using My Chart. They were already accessing things through these websites. And that particular tier with the digital divide in our communities, communities of color, especially with senior citizens, I don't think we took into account how big that divide was and how it really affected them getting registered. So even having like their daughters and great grandkids coming and helping them to register, by the time they realized that was the process, they were so far down the line. And so I think, we have to really kind of, back to what you said, can they register at church? Can they register in other places? We have to think around the resources that we had in the community. And that was the most vulnerable community, was the ones who had the biggest digital divide and how to be able to access those particular services.
Absolutely. Thank you so much for your comments. I can see, I can't read them all, but our chat is on fire with comments. I can see that. In a few minutes, Jen, I'm going to turn to you for questions from the chat, but I want to ask our panelists, it is obvious that there is a perception in many communities that the most vulnerable in African American community and Hispanic communities, the vaccine has not reached them. So you kind of hit on some of the reasons why. And one of them has to do with vaccine hesitancy. But the research is showing that there's hesitancy in all groups. It's not just African American or Hispanic populations, it's in all groups. So, having said all of that, my question to you is, what do you think has worked well with the distribution?
That's a tough question.
Yeah,
And everybody kind of stopped and paused.
Right, we had to think.
I did attend a mass vaccination event last week with the Congresswoman, with Congresswoman Cori Bush, and we saw the setup, having the initially a lot of the paperwork that needed to be processed. Bringing in the National Guard, I think was a good move to help process, get people in to move through those mass vaccination events better. In the city and in the county had a really particularly nice system set up, and they're right in the community. I like that they're at Redmond at the community center there, in the heart of the community. So, those are some of the things that went well. But again, it's such a small part of the population, in terms of the process they have a nice setup, right? But are we getting that out into enough people and having multiple, ones of those kind of events set up? And as we see, I'm hopeful because there's so many events coming up, these mega mass events coming up and all these different ones in different places. So I'm hopeful that we will do a better job and that things will go better. But it's really hard when so few people were able to access those things initially.
Were you finna go, Elizabeth?
Oh, you go.
I was just gonna add. I also think, I think just getting the supply in was slow, and our providers, at least from sitting at the task force table, really tried to work together to share what was coming in at first to make sure that all providers at least had some level of supply they could begin distributing to patients. Many of our providers have made adjustments. So like we talked about Christian, like they're going out trying to now enroll people at, on site at places. Many of our health centers, community health centers, like when they noticed many of the seniors were not responding to text messages or signing up online, they started calling them to invite them to sign up. And so that's really how they even built their list for their seniors to get in. Many people are at least trying to work together to share best practices about process and protocols. So to really talk about what works best. We've seen our city health departments, our county health departments really step up through this process. And for our city, who doesn't even have healthcare services, they really have partnered with EMS, our fire departments, and a lot of different other providers, National Guard, to really get out into the city to do several community events. And so I think with a lot of the issues that we have seen, like it's a lot of work really trying to make the best of what we do have in the region. And we've seen more supply come into St. Louis. So with many of the stories about out in rural counties where they have been essentially wasting vaccine because they've gone through their population so fast. We've seen the governor really and the state really shift the supply that they're providing to the region that St. Louis is in to make sure that we are at least having enough to cover our eligible populations, which has really caused a lot of the backup that we're seeing as well. So, I think many people are at least working together to try to make the best of what's happening, which is good. And then at least once you get there on site, I think as Miranda said, the process is working. I haven't heard too many complaints about process. So.
Yeah, I think those informal networks have been what has really worked. And I am hopeful that some of the partnerships that we're seeing that have come together throughout this past year of COVID, and that we are seeing, strengthened, I think, even with the vaccine distribution, will hold solid after, as we move forward. So if you think about the City of St. Louis Health Department working with the Housing Authority and with the Urban League to do vaccine distribution inside the Housing Authority for seniors who don't have transportation. And again, I saw in the chat somebody said, how about getting out to the homebound? And there are a lot of factors that make it difficult to get the Pfizer and the Moderna out to homebound, and so a place like the Housing Authority makes it a little bit easier, and the senior centers are getting people there and providing some of that transportation. So seeing those partnerships come together and seeing the informal networks, I think are really are the things that are working well, and that as I said, I'm just hopeful we'll learn from this and we'll keep those partnerships in place and those informal networks working over the long haul. The regional response team has been a critical player in those partnerships and making that a little more sustainable over time.
Elizabeth, can I echo what you just said? I was thinking the same thing, Urban League and going into the senior buildings. Also, you have to give a shout out to Affinia and your care STLs, because I've seen them Saturdays, doing those kind of mobile events with whatever vaccine they have, they've been trying to push it into the community. So definitely those community healthcare organizations have done everything that they can to try to push into the community.
So Cynthia had invited me, given the activity on the chat, to just give you all a sense of what's going on there. Lots of appreciation and validation of the comments that each of the panelists are making, as it's echoing the experiences that people are having. Won't surprise you that many of the people participating on our program today are doing their best from the roles they have to be a part of the solution, that they're deeply committed to serving one or more populations, and that they're here to represent and advocate. So just to share a few comments, few questions, see if there's something that you would want to respond back to from folks that have shared. Jason serves primarily people with disabilities, and he was mentioning that within the networks of people that they serve, that digital divide, that lack of internet access, can be up to 75% of folks. So we haven't talked yet about population of people with disabilities. Just want to pause and see if there's anything that a panelist would like to offer related to that particular situation.
Yeah, I know we talked about a few minutes about homebound populations, with partnering with the Senior Centers Housing Authority and different senior residencies. Also, the county, the public health department was piloting the homebound initiative with their fire department and EMS workers that were actually going out to people's houses to do it, that they are planning to expand. And I know try to bring that to scale to do more of that work. And the city is on their way to doing that as well. So many people are realizing the need to really reach those who are home and unable to get out. So I think we'll see more of that in the coming weeks. This process is changing so fast. So, daily things are changing. So, but definitely, I know there's a focus to really start getting vaccines to those communities.
And a special shout out to Paraquad that has worked hard to both get their constituents registered and now is working on some of the transportation pieces as well.
Great. So another population, and this definitely sort of springs from what Angela was just speaking about. Roxanne is working with, I'm not sure if it's in her professional life or in her sphere of concern in her life, the senior population, mentioning how frustrating and challenging it can be to put your name on a whole bunch of lists and really just to navigate this as a project if you're a senior or you love a senior. So should a couple questions, and recognizing that this may or may not be in your scope, but any suggestions for supporting a senior through this process, sort of minimizing the frustrations and maximizing the support. And then I think that this is actually likely a supply chain cold storage issue. She's wondering, would it not be easier to just put the vaccine in the hands of providers? And I know some of these vaccines have to be stored at a temperature that a standard doctor's office just cannot support. But if anybody would like to speak to either of those concerns for Roxanne, I'd appreciate it.
Well, to start off, definitely the Johnson & Johnson vaccine really does change the way that we can do this differently, because it is shelf stable, and it, that can get into the hands of providers. And I think it's just that, because it just got approved, it was the last one to get approved. I think now it needs more time for it to start to move into those different systems. So yes, it's coming. It's one of those things that's evolving and it's coming. Before, yes, you hit it on the nail on the head, Janet, that, keeping the Moderna and the Pfizer cold was a big part of the issue. Keeping it, well, not just cold, but keeping it at the proper temperature was the issue. A lot of the issue that, you had to have certain, even in, doing mass vaccination sites, being able to keep it, have the sites that had the refrigeration necessary to do that has been part of the issue. So Johnson & Johnson has definitely changed and helped to speed up the process in terms of, and I don't know if anybody else wants to comment on that before we talk about the seniors.
Just furthering that conversation, I chatted with the CEO of Visiting Nurse Association to see if they could do, get out to homebound, since their nurses go into people's homes. And this was before J&J was approved, or right around that time. And once you open that box that you get with the vaccines, you've got 3 days to use them all. And that's where we hear about this waste that we've been concerned about, of when vaccines have been exposed and are starting to not be at those temperatures any longer. And so the staffing that it takes to use and they come in boxes of like 1,000 or 2,000 or something, the staffing that it would take to get those into arms of people in their own homes is not feasible. And so that's why it's been so difficult to get to the homebound and to get that vaccine out. So, we hear about keeping the temperatures, but it's not just the temperatures, it's also, once that box is open, you've got to use them. It's really, I don't know the science, it's really complicated, but I just know that logistically it's been a real issue.
Well, we will have a program 1 week from today with somebody who will know the science deeply. So we understand the challenge, and Dr. David Curiel is going to explain to the extent people want to hear about why exactly this is and what specialized equipment is required. So I want to do one last sort of question reflection from the audience before pitching it back to Cynthia. I'm going to try to combine a question comment from Kimberly and one from Mimi, I'm not sure how she says her name. Really just talking about what can we do to make sure the community that we're trying to focus on is the benefit of the service that is trying to be provided, that issue that has already been raised. So Kimberly was citing an example of what appeared to be not people from the community coming into a community, because that's where the resource was. And Mimi is making phone calls. I'm not sure if she's doing this in her day job or if this is a volunteer thing, but to help drive traffic within a targeted audience to a service that's available. So I guess I just want to ask, are there any further strategies that we want to highlight? And if one of those strategies is what we can do as concerned citizens, as good neighbors, are there volunteer opportunities that you'd like to highlight?
In talking to some people from the health departments, they are trying to segregate those zip codes that are in that particular county or city, so that people are not registering and then coming into the county or city. So there's been a lot of talk. It has not been approved as of yet for that to happen, but they're really trying to do more targeting in terms of zip codes so that they can target the vaccine distribution from those particular sites. And I know that they are working really hard to do that, and that will help to increase people that are in that particular area actually getting the vaccines that are from that area, because that has been a struggle. We've gone even in the deepest part of the city, you've gone to some vaccination events and there were very few people of color. And again, it's how you get on the list. It's the process of, they're on the list first and, they got the vaccines or got those spaces first. And so now I think the health officials are pivoting to say, we need to make sure that people who are in this area can get the vaccine in this area and not have to drive 2 or 3 hours, for those that are even available to drive 2 or 3 hours to get the vaccine. So they are really working on a plan for that.
Yeah, I would agree with what Miranda just said. I think we talked about it earlier or prior to the start of this, is that, people who have resources and who have the capacity, they can drive out. They already knew to sign up on every list as soon as, the list became open. So they did get kind of the first calls, the piece of access to the vaccine. And I think now we are seeing more targeted efforts So like the city health department, they partnered with the Omega Center that's located in North County, and really that invited the people in those communities to come in. And so you did see a lot of other people outside the community coming to a lot of those events. And then I know our health director has said of the 1,300 people that came, not over 90% were African American from the community. And so definitely, I think having more efforts like that where you partner with community to invite community in really helps. As Miranda said, we don't have the capacity to really target by zip code as much as we like. And so we've seen states, California just got a waiver. And so they've actually set aside a certain percentage of their vaccines, I think it's like 40% or something, to target certain zip codes. So they can really only allow people in those areas to come in, which we haven't had the ability to do in our region or in Missouri. And so I think having some of those things in place would really help a lot of what we're seeing. And then just really getting out the education. And so we've talked about Prepare STL, or, in our initial things. And so we're now working to recruit champions, so people who live in the community, to be trained on how to carry out the word about information about the vaccine, how they're used, what they're for, pros and cons of getting those, so that people can begin to make those informed choice. So that those who are still, a little weary about getting it, that at least they have the information they need in order to go out, and provide them with the resources of how to sign up, helping people sign up as needed. So I think we're seeing more of that. And then as we get to move out to the larger community, there'll definitely be more, I know, educational pieces coming out to the general population about what they can do to get out there and get it, which we need a lot more, definitely, communications about the what and the how.
I would not be a proud alum of the Brown School without talking about the role that social workers and public health providers and community health workers can play in trying to make sure that people get the vaccine. I had a great conversation with Spring Schmidt. There were 4 of us, and she didn't know it, but 3 of us were social workers, and she said, what we really need are those social workers who are going to sit with someone, pick up the phone, make the phone call, get the appointment made, then the day of the appointment, make sure that that person gets to the appointment, has the transportation, is able to have someone to sit with them and wait the 15 minutes after your vaccine, and just really that role of good old-fashioned, it goes slightly beyond case management, but good old-fashioned social work. And our community health workers can do this. It's at some point we've got to be there and sit next to and with to make this happen, and we can do it. I think that's part of what those 200 community health champions are going to be doing, maybe, but anyway.
Thanks to you. Go ahead, Miranda.
Yeah, one more thing that I heard this morning is that there's a 50% decline rate because there's so many people on multiple lists. So those people that got, their name, they put their name on every list and they've already gotten the shot, they're still on all these lists. And so every time, they go through the process and invite people for the next one, they're going through 50% of those people have already gotten it someplace else. And so by the time, it's taking them longer to process to get to people that haven't gotten the shot. So I say shot, vaccine, sorry. I have a kid, so I'm always get your shots. So sorry. But, one of those things is if you've already gotten the shot, or somebody who's gotten the vaccine, if you can take your name off the list, that helps to get the processing through faster for people that are still actively needing to get the vaccine that are on the list.
And originally, there weren't ways of getting yourself off the list, and that might still be the case for the state registry. But I do know that now the hospital registries, most of them do have a way to unsubscribe. So,
yeah, and now they are also trying to share lists to kind of minimize some of the duplication. So people are on lists just to make sure we kind of get rid of some of the overlap. But definitely, when we first started, they were telling people just to sign lists and wait on an appointment. But they're trying to do much better about eliminating some of that at this point.
That is so awesome. This has been such a robust conversation. I'm so many questions from me and others have been answered. So here's one I'd like for you to answer. There is concern that demand will outpace supply, and that not only will demand for the vaccine outpace supply, but vaccinators, not
Mhm.
vaccination shots, but vaccinators are in short supply. Can you please answer those two questions?
I definitely think so. The next issue we're going to see is the capacity of actual vaccinators to do this, because they have to have. I think a lot of the side effects they're using like licensed professionals to do the shots in the arms, and they also are still trying to provide basic healthcare services, and so many of these providers are doing double duty. One of the things that we're looking at. For our community health centers is their ability to have volunteers. Right now, there are certain HRSA waivers in place that make it a little bit more difficult for them to do that. And so definitely, how do we get some of those restrictions waived, so they can actually have volunteer nurses, volunteer physicians to really come in and help expand some of that capacity, partnering more with our hospitals who are able to have more volunteers, our health departments. You know, the volunteers have made a huge difference in their capacity to do this. But definitely, I think just workforce is going to be the biggest issue that we're going to run up into as we begin to open to more populations. And that's just because they're trying to do a lot with regular service care delivery and this deal with this pandemic at the same time.
Yes, speaking for the Congresswoman, Nurse Cori, not Congresswoman Cori Bush, said, I'm ready to go give shots. And so she's trying to get the training done and she's making sure her license, you have my license, and she's doing everything because she heard that there was a shortage in vaccinators, right? So she's trying to get her friends and her nurse friends and other people to go through the process so that they can help to give the vaccine. So that is definitely an issue. I know at the Omega Center, they had a med students from St. Louis University School, and they're trying to get other different, like med schools and different people to have those that are eligible that, can do vaccines to be a part of that. One of the other things they really did was they got a group of students that were from the African American Association of Med School Students to try to get people that look like the people that they were giving shots. So they thought that that would help with some of the vaccine hesitancy that you see, other people that look like you giving the shot. So, I think, again, everybody's trying everything, but if you can give a vaccine, going through the process to try to do it is definitely going to be something that, and I know healthcare workers are tired. They have been fighting the COVID fight. And now we're asking them to volunteer to give vaccines. And I know they probably need a good nap right now, but if they have anything in them left to give a couple hours to some of these mass events, that is definitely going to help us push forward. But we certainly appreciate all of the things that the healthcare workers have been through this past year and asking for more and more. But we need you guys.
Next question I want to ask you, and thank you so much for your response. Compared to the rest of the country, we know that getting ahead of COVID-19 is primary, it's a priority for everyone. How do you think Missouri is doing compared to the rest of the country?
So knowing that question was coming, I looked at the New York Times May 16th, I'm sorry, March 16th update. And, if you look at the actual number, it doesn't sound like we're that far behind. The US is at 22% having one dose and 12% being fully vaccinated. Missouri is at 20% one dose and 11% fully vaccinated. And I thought, oh, well, that's not so bad. But then I looked at the comparison as to where we were compared to other states. And when we look at other states, we are eighth from the bottom. We are eighth from the bottom. So it looks a little better than that because, places like US Virgin Islands, Washington, DC, and Micronesia are also below us. But still, we're not there yet. we're not there yet. And I think the way the vaccine was originally distributed in our state, where there were the 6 or 7 different regions, and the vaccines going out to the regions, and regions where there were fewer people, and where people from St. Louis drove 3 or 4 hours each direction to, twice to get their vaccines, really plays into why we are 8th from the bottom.
I know that this question has really been addressed, but I want to give you an opportunity so that people who are remaining in our audience can have a clear understanding of the next steps. Recently, data shows that 71% of the COVID-19 vaccine administered in St. Louis went to white populations, while only 8% went to people of color. Why do these disparities exist? And more importantly, what steps are being taken to remedy the inequities?
I think we've talked about a few of them, but again, it goes back to how the supply was, originally just, given out to the state. It was not equitable. It didn't, really. There was an issue of equity that I think we missed in terms of really getting more supply into areas that had higher populations. We talked about the digital divide. Again, these are issues that are already plaguing our community. So if you already have a digital divide, this didn't help that we wanted people to register via the web services. Transportation and vaccine hesitancy. So I think those were some of those bigger issues starting off, and how are they being addressed now? I think we've been kind of touching on some of those things that we are finding that hesitancy, we're talking about it, and as people are talking about the hesitancy, and I'll just touch on one of them so that my co-panelists can touch on the rest of them. But the hesitancy, I think there's been a lot of elected officials that have taped themselves or gone on their social media showing them getting the shots or getting the vaccines, and I thought that was really good, so that they can show, hey, there are people that saying, I'm doing it, you can do it too. I think that was one way to get people involved. I think just, talking more about the science of how it works, and, just people talking about the risk versus the benefits, trying to get the hesitancy in our community to lessen, I think has been a good help.
Yeah, I'll just add on. I know we've talked about just and Miranda just talked about the distribution. I think we're seeing changes in that. And so even from the federal, what the president had an order that was sending more vaccines directly to our community health centers. So I think increasing that supply has definitely helped them be able to do more. We're hoping to see more community events. So definitely increase partnerships in community to get it out to many of these places. More education, as Miranda just talked about. And then, really breaking down transportation. That's another huge issue. We've seen partnerships for seniors. They have the partnerships with the Area Agency on Aging, AAA, AAA, however you call it, but definitely to, help those individuals, that population, sign up over the phone, schedule transportation, give them to appointments. So I think more partnerships like that. We work with the regional response team, and so a lot of the libraries and different other providers are stepping up to say how they can be helpful because they're located in the community and can help bridge some of this digital divide that we're seeing. So there's a lot of partnerships that are forming. I know this feels very reminiscent of the testing. Back last year when we started testing, we saw testing sites open up in West County before they made it out to North County, the city. For testing. So hopefully one of the things that I'm really hoping for, that we do a better job of collecting and using the data that we're collecting to really inform many of these decisions before we start. We were hoping we learned from the testing. We still have more learning to do, clearly. And so hopefully, as we go through this crisis, that we do a better job of really using the data to inform how we're going about distributing treatment and resources.
Okay. A last question nearly for me is this one. It's related to hesitancy, but it's a little bit different. Some people in the community, many communities, are waiting. They're waiting to see what happens to everybody else. And the more reports that we get of positive responses, the numbers might go up. What would you say to the person or persons who are waiting to see what happens?
Don't wait too long. You know, and I heard a talk yesterday on behavioral psychology and how if you see the people around you doing something, you are far more likely to do it. So again, we've heard about the public information campaigns, not just the Prepare STL informed decision campaign, but things like having past presidents and elected officials and the Dr. Adams as the superintendent in SLPS, and showing pastors getting their vaccines, that all of this helps. And so for those who are waiting, just don't wait too long, because the sooner that we can get to our herd immunization, the sooner we can open up, and that will, it's going to happen. It's going to happen. And so, jump in when you feel comfortable, and know that, the vaccines are going to continue to come until we can get all the Americans who want to be vaccinated. I can't even say it, but that it's going to happen. So we hope you'll come sooner than later.
I think Elizabeth said it perfectly. I will be very vulnerable. I am one of those people that said, I want to see if you start glowing first before I go. I'm one of those people, and I will share my vulnerability because I don't like shots. So that has been, my biggest hesitancy, so, but understanding that, a lot of talk about the variants, and people are saying, well, I want to know if these shots will protect us from the variants. And I think we have, what people are recommending is that get the shots now, because you don't want to wait to find out if you get the variant later. And so, we have to respond to, the latest information, and people not having the proper education and information around the vaccines that are available now and how they cover the variants that are prevalent in our state. And right now there's two variants that are in our state. One is not South African. It is actually the Southern California variant. There is a variant that is in Southern California, and then there's a trace amount of the UK variant, but that's only near the St. Louis airport. So that could just be travelers coming through. And so right now the variants are not as big of an issue in the state of Missouri. So the vaccines that we have are covering those things that, that people will say, I'll wait until they come up with something different to cover these variants. Get it now so that you can stay safer, and that we can get the herd immunity that we need as a region. And when those variants come, that we are more protected as a community before any of the other variants make their way to Missouri.
So we have made an hour disappear super quick. I want to pose one question specifically to Miranda, and then give everybody else a chance to also offer a closing comment. But I feel like I don't want to let the opportunity to ask you just a little bit more about the American Rescue Plan pass by. This was a really big deal. This was a big piece of legislation, and that was a large number that you quoted financially that's going to come into our area. I just wanted to give you an opportunity to comment as taxpaying citizens, as members of the community. What do you think we can look forward to because of that legislation?
Well, definitely. Thank you for that piece of time. And I know we're short on time, so we had a press conference just Monday that involve both Lyda Cruz and the mayor, as well as Dr. Sam Page. And it's on our Facebook page and on our Rep Cori, on all of our social media. And all of them talked about everything that we're going to include in that plan. So I want to reference that, and I'll try to chop it in the chat real fast so that you can listen to our leaders actually talk about what that's going to bring. But when you talk about $700 million in the community, we were already in a deficit in St. Louis City. So that $500,000 helps us cover the debt, as well as to have resources to try to bring us into a place that we haven't been in years and years and years. So it's bigger than just, COVID. This is an opportunity to really help us to stabilize in areas for those that are the most vulnerable. And in St. Louis County, though they got much less than St. Louis City, the cooperation between the city and the county is going to be what's really vital, and that they're talking and that they're walking the walk together. And what's good for the city is what's good for county, and what happens in county is also going to help in the city. So that's a brief thing about what's coming. So hopefully you'll go out and listen, and then we can we'll also share on our website all of the details of the American Rescue Plan.
Thank you so much for that. And final thoughts from our panelists, if you don't mind leaving this wonderful audience with whatever thought or call to action or whatever you'd like to say before we have to end.
I was just going to add that I don't know if people have been watching, but the CDC just released new advisement that, people who have been fully vaccinated and it's 2 weeks post your vaccine, that you can now be with family and friends without masks. So for those who are waiting or still considering, I think that is definitely some good news to help motivate, because earlier, when you still had to wear a mask, I was like, why do it if I still have to, social distancing mask? But I think just the aspects of being around family, when I think about my own response to getting the vaccine, is that really just being able to be with family and travel. Really want to travel. Is really was helping me move to say yes to that vaccine. So hopefully people are weighing their options and definitely thinking about what's best for them and their families.
And I guess my final word would be that I said this a little bit earlier, but out of every crisis, there are opportunities and there are positives that come. And we have seen, throughout this past year, a pretty broken system in many different ways. And we have also seen the power of community coming together to address those broken systems and to try to leave behind something better, something stronger, something more equitable, more vibrant than what we came to on March 11th, 2020. So anyway, I am so grateful to all of you out in the audience, and certainly to my two colleagues on this panel for the incredible work that you've done for the past year. And I'm very, very thankful that we get to be here to do a little bit to support your work.
And thank you, Janet, and thank you, Cynthia, for amazing open classroom sessions. I've caught several of them, and this is a big part of community education, and it means the world to us to have this forum to be able to share information with not only people in our area, but all across the world. So thank you for this opportunity.
Wow, thank you for that. I am actually going to tear up now, but we'll be off camera when that happens. To our panelists, thank you so much for being part of a solution to, I think, what was a deeply broken system that's highlighted a lot of problems, so much suffering. The light is finally coming towards the end of the tunnel. And I want to thank our audience for not only being with us, but the tremendous generosity in the chat of support and validation and resources. That is one of the reasons that I love getting to show up for these programs, that we gather together virtually as really nice people trying to make our community, our town, our world a better place. To my co-host Cynthia, thank you so much for leading this conversation. This was really a good one, y'all. So friends, please stay healthy, safe. Do what you can to help your loved ones and your neighbors stay healthy and safe. And we'll hope to see you again very soon on an open classroom. Take care and happy St. Patrick's Day, everybody.
Thank you.